So we've had these music tone therapies that I've developed on now for about 5 or 6 minutes. And so we've been activating specific areas of her brain to make her muscles better and make her balance better. And we will then show some further treatment protocols that we're going to do. But just to recheck her muscles now, bring your leg up again. This whole side was really weak on her. Does that feel a lot stronger? Does that feel a lot stronger?
Yes.
Now hold your leg out. And hold this out. And hold your hand back. And hold your arm in. So we've activated her extensors on this side, which is going to start creating stability for her and these impingement syndromes as we do some of the other things with her too. But this is a good way to actually start the whole process because you're activating those neurons to increase neuroplasticity. Now we're going to check her balance again. Can we maybe stand up first? Now before we had quite a bit of problems standing before. So we're just going to try it again.
Okay.
We'll just leave the music on for a minute.
Okay.
So I want to have you look at Becca. Haley. I'm going to have you stand on your right leg and lift your left. And tuck your chin down. You can see she's a lot more stable than she was before. You can take these off now too.
Thank you.
So now let's have you stand like that again. Do you feel a lot more stable?
A lot more.
As you can see, we've activated her cerebellum and her reticular formation here, and so her stability is much better. So that's going to take pressure off those areas that are becoming impinged, and your pain levels will start getting better. Her strength will come back. And next we're going to do some SOT blocking. So let's have you go face down. We're going to put this board underneath your hips. And we're going to block her for what's called category 1 in SOT, which is the same thing as a hemisphericity. Because of the weakness, her whole pelvis has shifted too, and by putting her on these SOT blocks, we're sending back proper afferent information back to the brain to activate all her paraspinal muscles, activate her extensors in her legs, extensors in her back and arms. And so by lying on these blocks for about 5 minutes and doing some other treatment protocols to make a correction on her pelvis, mid-thoracics, we'll do a correction on her occipital area, and then we also get involved in cranial therapy here due to the dural torquing. So we're going to come up to her cranium and do some cranial therapy, which will then help to take the whole torquing system out of her body, which will allow her to start to stabilize. We will then go into our gym and do some balancing with Bosu balls. We have a vibral plate. We'll be doing some eye exercises, which will really bring her back into stability, and she'll get better fast. And so you really have to look at the longitudinal level of the lesion to find out where the problem is rather than just treating the symptoms. And that's kind of what we're trying to get across here today.